Hi, everyone. Welcome to our third session with Carbon Health, where we bring questions that you have from the community to different physicians. And today, I'm really excited to be joined by Leilita Abhyankar, who is a clinical manager and primary care physician at Carbon Health. And Dr. Abhyankar, could you please just give a brief introduction to what long COVID is for our audience, since that will be our main topic today?
It's nice to meet you. It's nice to be here. Thank you for inviting me. So, most of us know that COVID, when you get it acutely, is about like a 10 to 14 day long illness that's a lot of respiratory symptoms and a constellation of other symptoms that can occur. Usually when you have post-COVID syndrome, or what's colloquially known as long COVID, that is something that lasts after that 4-week period of time. And it's a lot of chronic symptoms. It can be all sorts of symptoms. It can be associated with fatigue. It can be associated with some pulmonary symptoms. So that's what the current terminology of post-COVID or long COVID is designated as. So 4 or more weeks after the original SARS-CoV-2 infection.
And one thing that I was looking at during this research into long COVID was just how many people are actually suffering from this. And there's been a lot of larger studies trying to really pinpoint an exact number, but I mean, the studies are falling between 10 to 20% of all people who've had a COVID-19 infection. And I just am curious, like, what are some of the common signs or symptoms that you might see an individual experiencing if they come in with long COVID?
I mean, it can be a lot of different things. So I think it's up to like 10 to 40% is some of the numbers that I got, up to 23 million Americans. And so it's pretty significant in terms of like disease burden. Symptoms can, like I mentioned earlier, symptoms can be everything from like fatigue to chronic respiratory issues to just general fog, like brain fog, difficulty concentrating, and also just kind of low immunity. So like persistent symptoms like shortness of breath or cognitive difficulties. Some people actually do pick up, they can pick up similarities to like other post-viral syndromes. And so I think there's not a really specific constellation of symptoms that's titled post-COVID syndrome. It's really just what we're seeing as a change in status, if you will, for that particular patient.
Yeah, and this is all super new too. I mean, although COVID is entering its third year, research into long COVID is still taking some time to kind of get up off the ground. And I'm just curious if what are some of the new research that's being done just at a high level related to long COVID that might be showing some promise into this field?
I mean, I think that's something that I would want to ask you about, actually.
Yeah, I think right now a lot what I'm seeing is some connections between really looking into the brain. As you mentioned, there's that fatigue that's ongoing, the memory loss, and some other things looking at heart tissue. So that's really interesting to me because one of my side projects during my dissertation was actually investigating an organelle called the mitochondria. And the mitochondria is termed the powerhouse of our cells. So they produce a lot of energy. And one thing that's interesting is that mitochondria are actually enriched in the heart. So the most amount of mitochondria are found in cardiac tissue. And when we begin to see that those mitochondria are declining in their activity, then that's when we begin to see some cardiac defects. Now, again, this is all in like mice and even cell models that I was working with, but it really kind of gets to this question of, is there something that's happening maybe with energy production that could be causing some of these downstream effects in patients suffering from long COVID? So that's definitely something that I'm keeping an eye out related to both the cardiac system as well as the brain itself.
Yeah, so like when I have a patient who comes in who's had COVID recently, who's 4 weeks out, and those symptoms aren't necessarily resolving, or they're starting to just feel really low and uncertain about what their prognosis actually is. Like when I do the testing around it, I'm not just initially assuming that it's going to be post-COVID. right? So like I'm making sure that I'm looking at blood tests, I'm making sure that I'm looking at the thyroid, making sure that I'm looking at all the other like inflammatory markers. Is there another diagnosis here that we're actually looking for? And I think that that kind of speaks to what you're saying in terms of the really specific organs that are being targeted in some of this research, is that it can be affecting a lot of different processes. It can present as a completely different diagnosis, completely. So like, are we worried about rheumatologic conditions that are underlying? Are we worried about, clotting disorders? Are we worried about some sort of cardiac issues, especially because we know that COVID itself can affect the heart? And so finding out what is, post-COVID or long COVID ends up being this diagnosis of exclusion more so than being something that we can diagnose just because somebody has COVID in the first place.
Yeah, no, that's a great point. And even one of our viewers was asking a question related to the gut and long COVID, which is pretty interesting. And I'm not sure if they're asking this because they know, but the digestive system is also enriched in mitochondria. So that is really taking a lot of energy in order for us to break down the foods that we consume in order to make more energy. So it's interesting to know if the gut is actually being affected, which most of the long COVID studies are pointing towards there being symptoms related to gut or metabolism. That would also play a role in if that actual mitochondria is being affected. But another thing that's quite interesting that could also be altering digestion or metabolism itself is another marker that some of these long COVID studies have found, which is low cortisol levels. So low cortisol levels could be due to a long COVID that's still being confirmed, but a lot of studies are finding that to be consistent. And cortisol is an essential hormone in our body that kind of plays like this feedback loop where it's constantly cycling throughout the day in order for us to maintain our energy levels and to know, our bodies kind of know when to wake up and when to rest. And also it helps to maintain the balance between inflammation as well as responding to infections. So it does play a role in our immune system. So I'm just curious, have you seen any patients who have been experiencing something like fatigue that would be associated with maybe low cortisol levels at unusual times during the day?
Yeah, definitely. I would say that all of this is really a handful of patients. This is not something that most of the patients who I see who've had COVID in the past don't usually show up with symptoms 2-3 months down the line. The majority are doing much better by that time. So some of the timeline is that, a patient gets COVID, 4 to 6 weeks out, they're still not feeling well. They might still be feeling some fatigue. They might still be feeling some, post-viral syndrome is something that exists in most viruses. You have the virus affects a lot of the lung tissue, for example. So there's a lot of inflammation that just exists there for a long period of time. So it's almost expected that you would have a cough for up to 8 weeks after getting sick for any virus. And so similarly here, you expect a lot of those symptoms. As you were saying earlier, there is also gut inflammation that happens. Diarrhea is a known symptom of COVID. And so a lot of these processes can persist because that inflammation needs to die down. So you have cortisol, which is also actually, it contributes to inflammation, but it is a stress response in that. And so when your body gets stressed out, cortisol is absolutely something that's released from your adrenal glands. When you are in this kind of stressed out state, your body has trouble compensating sometimes. And so some of the things that I have seen, so as I think I mentioned to you before, that there was a particular patient of mine who was at a very high level in her organization who got COVID and came to me like 2 months later and it's like, I need to take naps in the middle of the day. I can't get through the day because I'm so tired. And these are, again, really anecdotal stories, but there is some consistency to them. And so it's expected if you have these post-COVID symptoms that they could last for up to 6 months. Usually by that point, most people are starting to feel better. But there's the more rare cases where it lasts for a year, I guess now 2 years if you got it in 2020. That's kind of how much data we have at this point.
Yep.
So we don't know how long it actually lasts.
And I think that that's pretty interesting for the community too, because we have a bunch of healthcare workers who also are interested in learning more about long COVID. And one of them kind of asked, and maybe you can give your viewpoint as a physician, how does that new information actually get into your hands? So say in 6 months from now, a year from now, we do know some signs of long COVID, we begin to have some treatment options. How does that information actually translate from the research side to now getting into physicians across the country and across the world to begin treating these millions of people who are suffering from long COVID?
Yeah, definitely. It's a really interesting question. I think things start to come to me when they're going to change my practice. So there's a lot of medications, there's a lot of treatment options, there's a lot of thoughts about how to treat post-COVID syndrome right now, right? For example, so people are trying all sorts of things. People are trying dietary changes, they're trying acupuncture, they're trying everything that's any kind of healing modality that exists is probably being overturned as a method to address these symptoms and this syndrome. At the point where there's enough evidence that, if I do this, it's going to be consistent. It works for most people. It works for enough people that it's worth trying. It works for enough people that it's not harmful in any way, and there's good outcome for success. So those kinds of things are the things that start to change my practice. And that's when I no longer feel like, oh, well, we're just going to kind of throw the kitchen sink at somebody and figure it out from there. I anticipate that people will start to have I hope that people will start to have some breakthroughs within the next 6 months to a year when it comes to some of these really long-standing symptoms, especially because they do, they are kind of on that, I think, that chronic fatigue syndrome, I don't know how to necessarily, I don't know how curable this is because I don't even know where to start approaching it in some aspects. It ends up becoming this really holistic approach where you do try multiple things. You try routines, you try changing your food, you try, making sure that there's no other underlying conditions as well. So I think it ultimately gets to you as a clinician on the ground when it can actually impact a significant number of people.
And that leads into more people asking, are there current treatments out there? And as far as I know, it's really just management of individual symptoms.
It is. It's absolutely management of individual symptoms. There are some kind of off-label uses for certain medications that are used in alcohol abuse, or that are used in, some pulmonologists might work with patients. A lot of it just ends up being what is clinically experimental. We know that these medications aren't otherwise going to cause harm. There's enough theories that, maybe this could work in this particular, it could affect this pathway, it could affect that pathway. I think as we know why it lingers for as long as it does and why it impacts people as significantly as it does, finding out some of the biomechanisms behind, the underlying pathology is really going to be helpful in targeting and addressing treatment. So right now it's really just, you could work with your primary care doctor to kind of figure out what symptoms to treat. There are some specialists that have kind of come up who are trying maybe some more niche things that you could work with. And that's kind of the routes that exist currently.
Yeah, and that was some things that I was looking into related to current research or even some prior research, was what treatments are actually have been investigated. And there have been some that were looked at, but of no promise, of no gain. There was really no statistical difference between those who received it and didn't. So it's important for those who are suffering to know that people are trying. I know that, of course, they want to have results sooner, but those studies unfortunately didn't work. And of course, having more studies with more population, a bigger sample size, is always of most interest. So hopefully, if there's additional funding, which is always a restraint in order to try to get these studies launched, that can try and find some relief to patients soon. And some individuals were asking related to vaccination. So was vaccination a factor in somebody getting long COVID or not? And if long COVID symptoms are possible if somebody did receive a vaccine against COVID-19. Have you seen that in your practice at all?
I haven't. So I haven't personally seen it in my practice. And I know that there's a lot of contention around like what vaccines do and do not do. I think that ultimately the risk versus benefit for a vaccine, there's always risks associated with anything that you're going to like take, right? Whether it's oral, whether it's injection, whether it is topical, there's always going to be that risk of it behaving in a way that you didn't expect it to, because everybody's different. Having said that, I think that the risk of an adverse outcome when it comes to the vaccine is not is always like something that I would expect people to, or hope that people can understand, that the benefit of the vaccine really does outweigh the risks associated with it. And so while, I think that we still need the numbers on whether or not people are feeling symptoms or feeling like they're more at risk for, post-COVID, if they were to get COVID later on, even after having been vaccinated, there's still, we're still waiting for numbers. But even having said that, I think that making sure that we're vaccinated on those things is really, really important ultimately.
Definitely. Again, just like one of the measures we have in place. So if we can kind of compile some of these tools in our tool belt, like vaccines and masks or public health measures, all of these things kind of work together, maybe not individually, but they need to come together in order to prevent something like long COVID.
Yeah, absolutely.
Another viewer is asking questions related to, are we seeing more people who are younger or older with long COVID, or, is there certain age groups where they're kind of immune to long COVID? What have you been seeing?
Yeah, so I haven't seen too many patients who are, under the age of 18 who have had any sort of prolonged symptoms of COVID. But again, a lot of these kids are back at school. A lot of these kids are now participating in activities. So while we are trying to, if there's any sort of injury they've experienced, or is there any like kind of underlying depression or a concussion or other sort of things that we're looking at, I don't know that we could necessarily tease it very easily from that.
Good point.
So there could be, I don't think that the morbidity, so that means like, I don't think that the impact in terms of how significantly it's affecting kids is as significantly as it's shown to affect adults. And so, but I think that was kind of the case with COVID throughout the past 2 years. Kids were not getting it as much. And so I think that the post-COVID symptoms that we're seeing just aren't as significant as adults, if we're seeing any.
No, definitely. And then another question related to one of the symptoms that somebody had been reading about related to long COVID was neurological symptoms. And that's really something that I'm not too familiar with. Do you have any experience on reading any of the literature on that?
Yeah, so part of the work up there, actually, like in addition to doing all the blood tests to make sure that there's nothing else going on, cognitive function, actually trying to diagnose and determine whether or not somebody qualifies for disability, because long COVID, post-COVID syndrome is actually something that can qualify a patient for disability. Okay. And so concentration, all of these kinds of things are things that I do evaluate. So yeah, there's a lot. I don't see as much neurological impact in terms of like motor symptoms. I don't see a lot of, or I haven't seen a lot of like numbness, tingling, those kinds of neurological symptoms. It's really mostly focused on cognition, fatigue, brain fog, things that again might be masked by thyroid or depression, or it could be a lot of different relation of things. So
yeah, and I mean that actually like sparks my interest to know a little bit more, like if as we begin to wrap up this conversation, just like related to having someone go on disability. One thing I was reading related to long COVID was just there's been a severe impact in the amount of people who have long COVID, and they've had to either reduce their working hours or they completely aren't working at all. And are you seeing that as well as like with what we're reading in the studies?
I've seen it. I've seen people within the first 6 months after having COVID that they've required that sort of short-term like medical leave, either during the middle of the day, reduced work hours, some time off. I have maybe like 1 or 2 patients who I've seen who require, long-term disability. Okay. And that's always really challenging. I think I think it's because it's so difficult to treat and because there's no like clear answers. One of the things that I've really been working with patients on is making sure that everything else is kind of optimized, right? So if you're having trouble sleeping, like let's help you with that. If you're having trouble doing some sort of activity, what movement can you do? What do you have energy to do? How can we make sure that you're getting all of the nutrition that you need in order to make sure that you're not feeling poorly? General wellness, like making sure that social connection exists. I think that that's one of the things that's really been severely impacted over the last almost 3 years now. And so that those kinds of things I think are really important to maintain. And also that the worry and the anxiety around when am I going to get better sometimes I think creates this mental loop for a lot of people. And so how can you just kind of take a break from worrying about when it's going to get better kind of thing? It doesn't sound, I think that's probably one of the most interesting things that I've talked to patients about is like, all right, cool. So we know that this is a difficult thing to kind of treat. We know that there's not clear treatments for it. How can we make sure that everything else in your life is as good as it can be? And how can we try to remove that worry? Is it seeing a therapist? Is it making sure that you are working with a family member, that you have someone to connect with? Is it trying to find how to optimize your quality of life just a little bit while you're actually struggling with all of these other symptoms?
I really love that you brought that up. I think that that's incredibly important and oftentimes kind of overlooked in some of the media related to long COVID, where they're only looking for treatment relief of the specific symptoms.
It's what you see in a lot of chronic conditions, right? Is that there is, you either have the chronic condition or you don't. But the reality is that you can live with the chronic condition at a pretty optimal quality of life, understanding that you have limitations because of whatever that chronic condition is, whether it is a heart condition, whether it is diabetes, whether it is something like, long COVID or post-COVID syndrome. All of that can be on a continuum of sorts. And so to really try to make sure that you are optimizing your quality of life in that moment, while of course, hopefully everybody's working on ways to make sure that you're better.
And with that kind of concludes our current segment on long COVID, but totally an open topic of things that we need to continue to look at in the future as more research is coming out. So I'm sure that we'll be talking again as some new stuff is out there and hopefully having some relief for these patients. So Lolita, I really want to thank you for coming on here and sharing the experiences that you've had. And I know that some of our viewers, they're going to want to be following along with whatever you're doing and some studies that you're looking at. So where can they find you over on Twitter in order to keep updated?
Yeah, so my handle is at @L_Abhyankar. You can find me there. Yeah, this has been really great. Thank you so much for speaking with me today.
Yeah, no, thank you, Dr. Abhyankar. So this wraps up this third segment with Carbon Health. And until next time with a new topic, everyone continue to stay safe, be well, and we'll talk soon. Thanks. Bye.